Good morning, everyone. I am delighted to welcome you all today. My name is Dr. S. Virgin Jeba, and I am an assistant professor of physics at Holy Cross College, Nagercoil. Today, I am excited to present to you on the fascinating topic of fluoroscopy imaging. In this session, we will explore what fluoroscopy is, how it works, and its applications in the medical field. So let's get started and delve into the world of fluoroscopy imaging together. Fluoroscopy imaging is a fascinating technique because it allows us to see moving images of the inside of the human body in real time. It's a dynamic form of X-ray imaging, which means instead of just taking a single picture, it provides a continuous stream of images. This method was actually developed based on a concept introduced by Thomas Edison all the way back in 1896. Unlike standard radiography, which gives us static images, fluoroscopy lets us observe how organs and tissues move as they function. One of the key features is that the X-ray beam stays on constantly during the procedure. This continuous exposure is what makes real-time observation possible. Typically, fluoroscopy produces around 30 frames per second, which is similar to what you see on a television. This high frame rate allows us to track how organs move over time, giving us a detailed view of physiological processes. This capability is especially useful for studying movements like swallowing, blood flow, or how organs function together. Because of its high temporal resolution, fluoroscopy provides insights into dynamic processes that static images just can't capture. However, to interpret these images effectively, it's important to understand how image illumination works and how our visual system perceives these moving images. Overall, fluoroscopy is a powerful tool that combines technology and physiology to help us better understand the body's complex movements in real time. Applications of fluoroscopy are quite diverse, and it plays a crucial role in many areas of medical imaging. You see, it's used in procedures like photospot imaging, which involves high doses of radiation but for very short exposure times to get detailed images. Then there's spot film acquisition, where static radiographs are captured during a real-time exam, allowing for precise documentation. Digital subtraction angiography is another key application. This technique helps us clearly visualize blood vessels even when they're surrounded by bony or dense soft tissue, which can otherwise obscure them. Endoscopic examinations are also common. These are non-surgical procedures using a flexible tube with a tiny camera at the end, called an endoscope, allowing us to visualize, diagnose, and sometimes treat internal organs, most often in the digestive tract. Another important use is lithotripsy, where shock waves or laser energy are used to break down kidney stones non-invasively, providing relief without surgery. And we also have cineradiography, which involves capturing radiographs of moving objects like the heart or joints, giving us dynamic insights into how these structures function. Now, it's essential to understand that working with fluoroscopy requires a good grasp of visual physiology. The radiologist needs to interpret continuously moving images, often under changing lighting conditions, which makes it quite a skillful task. All these applications highlight how versatile and vital fluoroscopy is in modern medical imaging, contributing significantly to diagnosis and treatment. The human eye plays a crucial role in fluoroscopic imaging, helping us interpret what we see on the screen. The eye itself is made up of several important parts, including the cornea, lens, retina, and iris. The iris is particularly interesting because it controls the size of the pupil, which regulates how much light enters the eye. In bright environments, the pupil contracts to limit light, while in dim lighting, it expands to let in more light. This adjustment is essential for clear vision across different conditions. Now, vision depends largely on two types of photoreceptor cells in the retina, rods and cones. Rods are highly sensitive to low light levels, which means they are responsible for our night vision, or what we call scotopic vision. On the other hand, cones handle our daytime vision, what we call photopic vision, and are also responsible for detecting colors. An interesting point is that in low-light conditions, our eyes become more sensitive to green light, with a wavelength around 555 nanometers. This is why green is often used in night vision and certain imaging techniques. Finally, there's the concept of dark adaptation, which is the process our eyes go through when transitioning from bright to dark environments. This adaptation takes time and is especially relevant during early fluoroscopy techniques, where understanding how the eye adjusts can impact image interpretation. Connecting this to our overall theme, understanding how our eyes work helps us appreciate the importance of visual physiology in accurately capturing and interpreting fluoroscopic images. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's talk about the different types of fluoroscopy imaging. Fluoroscopy can be broadly classified into two categories: direct vision fluoroscopy and image intensifier fluoroscopy. Starting with direct vision fluoroscopy, in this method, X-rays pass through the patient and then hit a fluorescent screen made of zinc sulfide. This produces faint light signals called scintillations. The radiologist then observes this image directly in a dark room, and to help with dark adaptation, they wear red goggles. While this might sound straightforward, there are some important limitations. Although it converts X-rays into visible light, the brightness of the image is quite low, which makes it hard to see details clearly. The efficiency of this conversion process is poor, resulting in a limited spatial resolution. That is, the image isn't very sharp or detailed. Another significant issue is the narrow viewing angle. This means the radiologist can only see a small portion of the image clearly at one time, which isn't very practical for most procedures. Plus, because the images are so faint, the radiologist needs to spend about 10 to 20 minutes adapting to darkness before they can see the image properly. And it's worth noting that this method involves a relatively high radiation dose to the patient. Due to these numerous disadvantages, low brightness, poor resolution, limited viewing angle, and the need for darkness, direct vision fluoroscopy has been phased out and is no longer used in modern practice. Instead, we now rely on more advanced imaging techniques that provide better visualization with lower radiation exposure. Now, let's take a closer look at how the image intensifier fluoroscopy system works. When X-rays pass through the patient, they are absorbed differently depending on the tissue density. This means denser tissues like bone absorb more X-rays, while less dense tissues like soft tissue absorb less. As a result, we get variations in the amount of radiation that makes it through. This transmitted radiation then hits the input phosphor of the image intensifier. Here, the X-ray energy is converted into visible light. This is the first key step in creating a real-time image. The visible light is then transformed into electrons, which are then accelerated and focused by electric fields onto a smaller output phosphor. This focusing process amplifies the image, making it brighter and clearer. It's essentially intensifying the image, which is crucial for better visualization during procedures. The intensified image is then captured by a television camera and displayed on a monitor. What's really advantageous about this system is that it allows for real-time observation. So, no dark room needed, and surgeons or clinicians can see the live movements and details as they happen. It's a powerful tool that enhances both safety and efficiency during imaging-guided procedures. Let's take a closer look at fluoroscopy imaging with an image intensifier. This technology is fundamental in medical imaging, especially in procedures requiring real-time visualization. The image intensifier amplifies the X-ray signal, allowing us to see detailed images on the monitor instantly. This means we can guide instruments precisely during interventions, improving accuracy and patient safety. The key advantage here is the ability to observe dynamic processes as they happen, which is crucial in many diagnostic and therapeutic procedures. Overall, fluoroscopy with an image intensifier enhances our ability to perform minimally invasive procedures with greater confidence and precision. Now let's take a closer look at the image intensifier, or II, which is a vital component in fluoroscopy. It consists of an evacuated glass envelope that houses four main parts: the input phosphor, focusing electrodes, the anode, and the output phosphor. Each of these plays a crucial role in transforming X-ray images into visible ones. The input phosphor is where the X-ray photons first hit and are converted into light. From there, the focusing electrodes help direct and amplify this light, guiding it toward the anode. The anode then further accelerates and focuses the electron stream, which finally hits the output phosphor, converting the electrons back into a visible image. Another important aspect is the use of a collimator. This device helps restrict the X-ray beam to only the necessary area, which reduces unnecessary radiation exposure for the patient and staff. It essentially ensures we're imaging only what we need to see. And once the image is produced, it can be viewed directly on a monitor for real-time assessment, or it can be recorded using video systems. This recording capability is especially useful for detailed analysis later on or for documentation purposes. All these components work together to provide clear, real-time imaging that is crucial in many diagnostic and interventional procedures. This integration of technology highlights how advanced imaging systems have become, improving both safety and accuracy in medical imaging. Now, let's discuss how image brightness in fluoroscopy is influenced by several key factors. First, the anatomical region being examined plays a role because different tissues absorb X-rays differently, which affects the brightness and quality of the images. Next, the kilovoltage, or kVp, determines the energy of the X-ray beam. Higher kVp generally produces more penetrating radiation and can influence image brightness. Additionally, the tube current, measured in milliamperes or mA, controls the number of X-ray photons generated. Higher mA results in more photons and a brighter image. Typically, fluoroscopy operates at a low current range, about 1 to 5 mA, and it produces roughly 30 images per second. Because fewer X-ray photons are used per image, the resulting fluoroscopic images tend to be of lower quality compared to standard radiographs. This lower photon count makes it challenging to achieve high image clarity. To counteract this, high-gain detector systems like image intensifiers are essential. They boost the image brightness and visibility, making it easier to interpret the images accurately during procedures. Now, when comparing image intensifier fluoroscopy to direct fluoroscopy, there are notable advantages. Image intensifiers offer brighter images, improved contrast and resolution, and they eliminate issues like dark adaptation, which can occur with traditional systems. Most importantly, they reduce radiation exposure for both the patient and the operator, aligning with our overall goal of safer imaging practices. Understanding these factors helps us optimize fluoroscopic imaging, ensuring better diagnostic and therapeutic outcomes while maintaining safety.